So my name's Sarah Haynes. I'm one of the Frailty Nurse Lead for Lincoln Health Partnership Primary Care Network, working closely with the Enhanced Care and Care Home team for the leadership from there.
Can you describe your experience of Whzan?
It was about a year and a half to get all the care homes on board and using it, but it is being really utilised now. And as I've said previously, we've got all 10 care homes on it now, including my mental health home that actually gave the Whzan box back at one point, and they've actually got a new manager and deputy, and they're really keen to get up and running with it as well.
Did you receive training on how to use Whzan when you were first given it?
Initially, when so I wasn't here when the homes were given the box. I've never been formally given training on the Whzan box. I learned it as I went on with the SOP that was provided by you guys, I think, Lincoln. And then we got Damien to come in and do some training with the care homes. And then from there, I took on the responsibility, and now I've handed that back on to you.
So have you noticed an impact on communication and engagement as a result of Whzan? And if yes, what was the impact?
Yeah, so the communication and impact. So again, there's a couple of mixed feelings on this, but in elderly, as we know, their bodies change, medication becomes too strong for their body intake. So we try and aim to get our homes to do monthly blood pressures on the Whzan kits. When we have got our care coordinators in, unfortunately, we've got them off sick at the minute, but they will look at them results, and then anything that's abnormal, they'll report back to me and Mark. And then we can action that pretty quickly. So, for example, if someone's had quite long-standing high blood pressure and we've had them on antihypertensive medication for the last year or so, and now we're seeing a massive dip in their blood pressure, that would prompt us then to look at the traits and then to change that medication. So that's a good point for it.
So does Whzan support partners to better understand the needs of care home residents and enable better decision making?
Yeah, I think so. I think it's really hard, isn't it? Because from my point of view, I know my residents inside out, bar the transitional and active recovery beds. If someone rings me and says, Mr. Smith, for example, is more confused, symptomatic, in the toilet more often, I can quickly say, put the obs on Whzan, I can quickly review, and then because they're symptomatic, that would enable me to prescribe the antibiotics there and then. For a chest, that's the other benefit of it. I think it does build better relationships, and I'm excited to see how the CAS pilot works out with CAS and the care homes as well, because I think that's the next big step for Whzan, really.
Has Whzan had an impact on patient or residents' outcomes?
Yeah, 100%. So I think while we've been short-staffed, it's been hard for me to go and see all the acute and the new patient reviews. The new patient reviews, especially on the active recovery beds, are only with us for a short period of time. So we've started utilising the Whzan and doing the video call, like I've said earlier, and just to have that quick check-in, which I would normally do face-to-face. Obviously, if they need a face-to-face, I'd go out and do a face-to-face, but the ones that don't need a face-to-face, we've been doing a video call, and they've found that really beneficial. Now, I did think, how is this going to work, especially with your dementia, confused patients? Are they going to understand that we're on a video call? And I have found the feedback, especially from my active recovery beds, that they've found it really helpful, that they've had a healthcare professional be treating them within 24, 48 hours and had eyes on them. And they've really loved using the video call, which I was really surprised at. So yeah,